Students, very good morning to all of you. Now let us discuss about the functioning of the sensory organs. So first is the visual impairment or vision impairment. A healthy individual has normal visual acuity about 20 by 20 vision or by 6 by 6 vision. Okay. So what is the meaning of 20 by 20 vision? 20 by 20 vision is a normal vision acuity. Here individual see the object very clearly and sharply. If you have a 20 by 20 vision, you can see clearly at 20 feet. If you have and also be 6 by 6 vision is similar to the 20 by 20 vision. The some persons say that is 20 by 20 vision and also 6 by 6 visions. So in the 20 by 20 visions, that means person can be see the object at 20 feet, a distance of 20 feet, and 6 by vision that describe describe that the individual see the object at 6 meter distance. So 20 by 20 vision is equal to the 6 by 6 vision. The 20 feet also equal to the 6 meter. When we know that 1 feet is equal to 0.3048 meter. So 20 feet is equal to 0.3048 into 20 is equal to approximately 6.096 meter. So 20 feet is equal to the 6 meter. So some persons that say that 20 by 20 vision, and other persons also said that 6 by 6 vision. Both are similar. 20 by 20 vision, visual acuity persons can see the object at distance of 20 feet, and the 6 by 6 vision persons or 6 by 6 visual acuity person can see the object at 6 meter distance. So 20 feet is equal to 6 meter, and 20 by 20 vision persons is also same that is the 6 by 6. The 20 by 20 vision कहवा जहाँ 6 by 6 vision कहवा से 20 by 20 vision व्यक्ति कौन करे गोटे वस्तु को 20 फीट डिस्टेंस रे देखि थाए एवं वस्तु को से ठीक भाव देखि पारे. 6 by 6 vision व्यक्ति मध्य 6 मीटर डिस्टेंस रे से ऑब्जेक्ट को भल भाव देखि थाए. ओके. So 20 by 20 vision describes same ability as like the 6 by 6 vision. तो 20 by 20 vision 6 by 6 vision से किए कहते 20 by 20 vision किए कहते 6 by 6 vision. आम जदि कैलकुलेशन करबा 1 feet is equal to 0.3048 meter and 20 feet is equal to 0.3048 in 20, approximately 6.096 meter, or 20 feet is equal to 6 meter. सो आवर नॉर्मल विजन जदि कहबा ताले जदि व्यक्तिर 20 by 20 विजन थिबो ताले नॉर्मल विजन कहि थाउ से वस्तु भले देखि थाए एवं 6 by 6 विजन मते कहि थाउ से वस्तु को मते भल भाव रे 6 मीटर डिस्टेंस देखि थाए. 20 by 20 विजन रे 20 फीट डिस्टेंस देखि थाए, 6 by 6 विजन रे 6 मीटर डिस्टेंस रे देखि थाए. एंड विजुअल acuity measured by the Snellen scale. Snellen scale गोटा अछि तो से सिग्नल स्केल माध्यम रे विजुअल acuity मेजरमेंट करा जाय थाए. ए सिग्नल स्केल रे कोन हुए ना ए सिग्नल स्केल रे तो फर्स्ट अक्षर टी लिखा जाय थाए. तो व्यक्ति 60 सेटा को आम 6 by 60 कही था कहीं जो व्यक्ति टी अक्षर को देखी थाए ताले 60 मीटर डिस्टेंस रे गोटे नॉर्मल स्टैंडर्ड विजन व्यक्ति 60 मीटर डिस्टेंस रे ए टी अक्षर को स्नेल चार्ट रे भल भाव पड़ी थाए एवं स्नेल चार्ट पढ़ापा हेले डिफरेंट टाइप ग्लास यूज करि थाए. जदि तार आई पावर ठीक न थाए ताहले से जो अक्षर को पढ़े से अनुसार तार स्कोर करा जाय थाए. सपोज एग्जांपल ग्लास देकी से टी अक्षर को पढ़ी पारला सब ऊपर इन द टॉप पार्ट दैट इज द लेटर इज द टी, एंड इफ द पर्सन्स read the letter top upper part at the 60-meter distance away, then score is about 6 by 60 vision. So visual acuity of the person has 6 by 60. If the person in the if the persons read the letters second level at 36-meter distance away, then the visual acuity score is about 6 by 36. তাহলে প্রথম উপর লেভেল অক্ষর যেତେବେଳେ সে পড়িলা তাহলে গোটে নর্মাল স্ট্যান্ডার্ড ভিଜন ব্যক্তি যদি 6 মিଟর ডিস্টান্সরে অକ୍ଷরକୁ পড়ি ପାରିଲା ତାହେଲେ ତାର ଭିଜୁଆଲ୍ ଆକ୍ୟୁଇଟି ହେଉଛି 6 by 60. ସେଇ ଟାଇପ୍ର ଯଦି ସେକେଣ୍ଡ ଲେଭେଲ୍ର ଅକ୍ଷରକୁ ବଟମ୍ରୁ ଯେତେବେଳେ ଆମେ ଗ୍ରାଜୁଆଲି ଡାଉନ୍ ଆଡ଼କୁ ଯିବା, ଟପ୍ରୁ ବଟମ୍ ଆଡ଼କୁ ଯିବା, ତ ଟପ୍ରେ ଯେଉଁ ଲେଟର୍ଟା ପଡ଼ିଲା ତାକୁ 60 ଡିଷ୍ଟାନ୍ସରେ ସେ ପଡ଼ିଲା ବୋଲି ତାକୁ 6 by 60 ଭିଜୁଆଲ୍ ଆକ୍ୟୁଇଟି ସ୍କୋର୍ ଦେଇଥିଲୁ। ଏବଂ ଯେତେବେଳେ ସେ ଟପ୍ରୁ ବଟମ୍କୁ ଆସିଲା ଭିତରେ ସେକେଣ୍ଡ ଲେଭେଲ୍ର ଅକ୍ଷରକୁ ଯେତେବେଳେ ପଢ଼ିଲା, ମନେକର ସେକେଣ୍ଡ ଲେଭେଲ୍ ଅକ୍ଷର ୱାଇ ଓ ରହିଛି, ତାହେଲେ ସେଇଟା ସେ ଅକ୍ଷର ଏଇଟା ବି ଲେଖା ହୋଇଥାଏ ଯେ ତାକୁ 36 ମିଟର ଡିଷ୍ଟାନ୍ସ ଆୱେରେ ଗୋଟେ ଷ୍ଟାଣ୍ଡାର୍ଡ଼ ଭିଜନ୍ ବ୍ୟକ୍ତି ଦେଖିପାରିବ। ଯେଉଁ ବ୍ୟକ୍ତି 36 ମିଟର ଡିଷ୍ଟାନ୍ସ ଆୱେରେ ସେକେଣ୍ଡ ଲେଭେଲ୍ ଅକ୍ଷରକୁ ପଢ଼ିପାରିଲା ତ ତାକୁ ଆମେ ସ୍କୋର୍ ଦେଲେ ଭିଜୁଆଲ୍ ଆକ୍ୟୁଇଟି ଭିଜନ୍ ସ୍କୋର୍ ଦେଲେ 6 by 36. Similarly, the persons who a standard vision persons who will read the letter at the 24 distance away, the visual acuity score is about 6 by 24. Similarly, the person who read the letter at the fourth levels letter from the top part of the line chart at the 18-meter distance away, then the visual acuity score is about 6 by 18. In same thing, the persons in the 12 distance away, the persons who the normal visual standard persons who see the letters at the 12 distance away from the top part of signal chart, when he or she read the fifth levels of the letter, then the visual acuity is about 6 by 12. When she read the object sixth level, that is at the 9-meter distance away, then the visual acuity is 6 by 9. When the persons from second bottom levels, when the persons read the letters in the second bottom levels or seventh level from the top part of the letter, ତାହେଲେ ଉପର ଆଡ଼ୁ ଯେତେବେଳେ କାଉଣ୍ଟ କରିବା ତାହେଲେ 7 ଲେଭେଲ୍ ହେଉଛି, ଯଦି ତଳ ଆଡ଼ୁ କାଉଣ୍ଟ କରିବା ତାହେଲେ ସେକେଣ୍ଡ ବଟମ୍ ରହୁଛି। ତାହେଲେ ସେକେଣ୍ଡ ବଟମ୍ ଯେତେବେଳେ ସେ ପଢ଼ିପାରୁଛି, the standard vision persons who read the object read the letters at the 6-meter distance away, then the visual acuity person is 6 by 6. When the 6 by 6 is the normal vision standard of the persons, it is when the persons is very clear the object. Okay, so this is the criteria of the signal chart. So when the person's visual acuity less than 3 by 6, that means the person's visual acuity cannot see the object at the 6-meter distance away, or the person's visual acuity remains between the 3 by 60 and 6 by 60. The person's visual acuity remains 6 by 60 or above, then person goes to the blindness, that is severe sight impaired. Okay, the partial sightness persons, the visual acuity remains between the 3 by 60 to 6 by 60. The persons can see the read the letters at the 60 read the letter at the distance of 60 meter away, and then the visual acuity is about 3 by 60. So 3 by 6 visual acuity persons, that means letter the 3 means the persons sit in the close to the chat at the 6 meter distance. They will be close to chat at the 6 meter distance away. They will see the read the chat. When the at the 60 centimeter distance away, they close the chat or close the sit the in the close to the chat, and also they also sit close to the chat at the distance of 60 meter away. The person is known as the blindness or severe sight impaired. When the person's visual acuity between the 3 by 60 to 6 by 60, it is the full field of vision, and that is known as partial sightness. Okay, up to 6 by 24, that is known as moderate reduce of field vision. Okay, in the medical nursing in the second year, the visual acute and visual impairment and the normal vision, how much feet will we see, how much distance will we see, that in details that is described the medical nursing the second year. Okay, so the persons who go to the complete vision loss or blindness, that is means poor visual acuity, that is means the visual acuity less than 3 by 60, or poor visual acuity between 3 by 60 and 6 by 60. So here when the person's visual acuity between 3 by 60 and 6 by 60, then the poor visual acuity, and the severe and the having average visual acuity 6 by 60 or above, then person is the severe reduction in the field visit. তাহলে যার ব্যক্তির 3 by 60 ରୁ visual acuity কম রହୁଛି ସେ ବ୍ୟକ୍ତି blindness ହେଇଯାଉଛି, एवं 3 by 60 और 6 by 60 ଭିତରେ ରହୁଛି visual acuity, that is poor visual acuity, ବ୍ୟକ୍ତି ମଧ୍ୟ blindness ରେ ଥାନ୍ତି ବୋଲି ସେ ବ୍ୟକ୍ତି blindness ରେ ଅଛି ବୋଲି କହିଥାଉ। ତ 3 by 60 6 by 60 means what? Here a person can see at 6 meter what someone with standard vision could see from 60 meters away. Okay, तो व्यक्ति कौन करुचे 6 मीटर रे को देखी पारुची बा पढ़ी पारुची, लेटर पढ़ी पारुची, किंतु स्टैंडर्ड विजन रही कि से 60 मीटर डिस्टेंस आवे जेहेतु 6 मीटर डिस्टेंस भी कौन जिन देखिपर पढ़ी पार से विजुअल आक्यूटी को 6 by 60 रे लिखा जाए। तो ये 6 मीटर डिस्टेंस भी देखुची, ताले स्टैंडर्ड विजन थाई कि 60 मीटर डिस्टेंस आवे देखुची, तेणु 6 by 60 को गला। 3 by 60 मान मीन्स व्यक्ति पूरा पाखरे बसिकी जिनस को पढ़ी पारुची एवं स्टैंडर्ड विजन थाई कि 60 मीटर डिस्टेंस आवे रही जिनस को पढ़ी पारुची, देखी पारुची एवं जानी भी पारुची, लेटर को पढ़ी भी पारुची। 3 here written 3 means he is closer to the chart, से चार्ट जो सिग्नल चार्ट रे पूरा क्लोज होइकी सेठी बसुची एवं लेटर को पढ़ी पारुची। ओके, so in the top part there is the biggest letter, so that is correspond to 60, so that it is written as 3 by 60. So persons will sit in the close to the chat, so top letter is correspond to 60, so then that is written 3 by 60. When the persons in the second button levels will visualized with the 6 meter distance away, they can see the object, then it is written as 6 by 6. So common cause that lead the vision loss or visual impairment, that is include so when the eye becomes injury during the playing, during the work, during the accident, then eye injury occurs. Particular injury in the cornea and the commonest cause of that is vision loss. सो कर्निया कौन हुए ना इंजुरी हवा द्वारा कौन हुए ना विजन लॉस होता है आमर स्क्लेरा कर्निया अच्छे जो कर्निया पार्टे कौन से इंजुरी हुए से विजन लॉस हो जाए पर्सन ब्लाइंडनेस को सिचुएसन रही है जिते व्यक्ति कौन समय खेलुवे कौन से कम करुवे एक्सीडेंट होगला विजन लॉस हो जाए से कर्निया इंजुरी हो जाए एवं व्यक्ति विजन लॉस होता है व्यक्ति ब्लाइंडनेस को चली जाए ओके आमर इनहेरिटेड कंडीशन ऑफ ब्लाइंडनेस एंड विजन इम्पेयरमेंट इनहेरिटेड कंडीशन ऑफ ब्लाइंडनेस होता है ओके इनहेरिटेड कंडीशन ऑफ ब्लाइंडनेस जोटा कहते रेटिनाइट्स पिगमेंटोसा इज द मोस्ट कॉमन कज ऑफ इनहेरिटेड ब्लाइंडनेस ब्लाइंडनेस मत वंशगत होता है से इनहेरिटेड कहुई एग्जांपल इज द रेटिनाइट्स पिगमेंटोसा retinitis pigmentosa is a commonest cause of inherited blindness. In the retinitis pigmentosa, the back wall of the retina becomes damaged, or the retinal cell becomes damaged. Then come to the infection of the eye. Some German measles that are transferred from the mother to the fetus during the pregnancy period. After delivery, the German measles transfer from the mother to the baby. Okay, and that causes the blindness or visual impairment. Then trachoma of the eye caused by the contagious microorganism called the chlamydia trachomatis also will damage the eyesight. Due to the poor water and sanitation facility, the trachoma of the eye will be developed, and it is caused by the chlamydia trachomatis, by which eyesight becomes damaged. The person cannot see the object properly. Then come to the amblyopia. The childhood period, one eye becomes has the visual loss, so that is known as amblyopia. In the amblyopia case is known as the lazy eye. Okay, and here decrease the eyesight due to the abnormal visual development. It occurs in the early childhood period when nerve pathway between brain and eye are not properly stimulated. The brain focused to the other eye also. So amblyopia is a condition where it occurs in the early childhood period where decrease the eyesight, and amblyopia is known as a lazy eye. And why amblyopia occurs? Because nerve pathway between brain and eye are not properly stimulated. So the brain focus to the other eye. Then come to the cataract. So cataract is known as the cloud part of the entire lens of the eye, and is the clouding of the normal clear lens of the eye. So normal जो clear lens अच्छी से कौन clouding है जो cloud भलिया देखा जीवो से आई लेंस ऊपर clouding पूरा कवर करिक रहिबो तो अच्छा कवर करी रहबो से कहते cataract. A cataract is a dense cloud area that forms in the lens of the eye. Okay, and cataract prevents easily passing of light through the lens to retina. जो लेंस तार रेटिना को जो लाइट जाउची cataract कौन करिवो ताको प्रिवेंट करिवो जा फल कि लाइट लेंस रु रेटिना को जाई परिबो नै ताको हम cataract कहि थाउ. Then come to diabetic retinopathy. Diabetes always affect to the small blood vessel of the retina, and by which that causes the impairment of the vision. Then come the glaucoma. When the intraocular pressure inside of the eye raises, that causes the visual loss and damage the optic nerve. Okay, द विजुअल लॉस कॉज्ड बाय द डैमेज ऑप्टिक नर्व। सो इंट्राक्युलर प्रेशर जितने आई इनसाइड इंट्राक्युलर प्रेशर अधिका हो गला से कौन कर ऑप्टिक नर्व को डैमेज कला तापर विजन इम्पेयर्ड व्यक्ति विजन इम्पेयर्ड रहा तो विजुअल लॉस व्यक्तिर है। ओके, it is also seen in the older adult and as well as the baby case. Okay, then come to the age related macular degeneration. As a macular damage occurs, there has a loss of vision also occurs. The macula is the most sensitive part of the retina. When the macula will be damaged, then vision there has the loss of vision, and it is a risk for some who expose the sunlight. The person who most exposed to sunlight, that person has the macular degeneration. The macula becomes damaged. Then come to the AIDS related visual impairment. When the person is affected by the cytomegalovirus, it is a viral infection, then the individuals affected by the also the persons when the cytomegalovirus okay CMV, it is known as a CMV retinitis or cytomegalovirus. When it is affected to the human body, it is a viral infection, so that the person's vision will be lost. Okay, then come to the cancer of the eye, that is retinoblastoma. Eye cancer that begin in the back of the eye, retina, most commonly in children. It occurs in the most commonly in the children. सो आईर बैक साइड रे कौन हम जो आम आईर बैक साइड जो रेटिना अच्छी द कैंसर विल बी डेभलप इन द रेटिना ऑफ द आई मोस्ट कॉमनली इट इज सीन इन द मोस्ट कॉमनली इन चिल्ड्रेन, दैट इज नोन एज रेटिनोब्लास्टोमा. So retinoblastoma is the most common eye cancer of children. Retinoblastoma in the back of the eye, that is known as retina. In the retina, the cancer or tumor will be developed. A tumor will be developed, so that person, so vision gradually person's vision loss. Then come the types of visual impairment. Persons having either poor visual acuity, that is 3/60 to 6/60, always I had said that the 3/60 persons, that is 3 here written, that means persons will be very close to see to the chart. When the individual goes to the eye test, some glasses will be given to the patient in the presence of a doctor, a technician. The serial chart is there and various type of letter is written there from top to bottom. Okay, and in many distance there has the many distance of the glasses. So which letter is read by the patient by through by the glasses. Here 3/60 means the person is very close to the chart at the 60-meter distance away. They can read the letters or see the object. And 6/60 means also be in the standard normal standard vision, the persons will see the object, read the letters at the 60 meter distance away. তাহলে 60 মিଟর ডিଷ୍ଟାନ୍ସ ଆୱାରେ ବ୍ୟକ୍ତି ଯେତେବେଳେ ବସ୍ତୁକୁ ଦେଖିପାରୁଛି ବା କିଛି ଜିନିଷକୁ ଅକ୍ଷରୁ ପଢ଼ିପାରୁଛି, ସେ 6/60ରେ ଦେଖିପାରୁଛି ବା ପଢ଼ିପାରୁଛି, ଏବଂ 3/60 ମଧ୍ୟ ଦେଖିପାରୁଛି ବା କୌଣସି ଦେଖିପାରୁଛି ବା ପଢ଼ିପାରୁଛି. ତା ଅର୍ଥ ହେଲା 60 ମିଟର ଡିଷ୍ଟାନ୍ସ ଆୱାରେ ବ୍ୟକ୍ତି 3 ଅଛି ମାନେ ସେ ବହୁତ ଚାର୍ଟ ସହିତ କ୍ଲୋଜ୍ ରହୁଛି ଏବଂ ସେ ଲେଟରକୁ ସେଇ ଟାଇପ୍ର ଲେଖାଯାଇଥାଏ 3/60, 6/60, 6/24 ଏଇ ଟାଇପ୍ ଲେଖାଯାଇଥାଏ. ସେଇଟା ସିଗ୍ନାଲ୍ ଚାର୍ଟର ଡିଷ୍ଟାନ୍ସ ଅନୁସାରେ ସେଇଟାକୁ କାଲକୁଲେସନ୍ କରିକି ଲେଖାଯାଇଥାଏ. ଏବଂ ବ୍ୟକ୍ତି ଯଦି 3/60 ବ୍ୟକ୍ତିର ଭିଜୁଆଲ୍ ଆକ୍ୟୁଟି 3/60 ଟୁ 6/60 ରହିଲା, ତାହେଲେ ବ୍ୟକ୍ତିଟି ପୁଅର ଭିଜୁଆଲ୍ ଆକ୍ୟୁଟି ଅଛି ବୋଲି କହିଥାଉ. ଆଉ ଏଥିରେ ବ୍ୟକ୍ତି ଫୁଲ୍ ଫିଲ୍ଡ ଅଫ୍ ଭିଜନ୍ ରହିଛି. और मॉडरेट विजुअल आक्यूटी व्यक्ति कौन व्यक्तिर विजुअल आक्यूटी रही 6/24, दैट मीन्स 24 डिस्टेंस आवे गोटे नॉर्मल स्टैंडर्ड विजन व्यक्ति जार 6 रोचे आई पावर 24 डिस्टेंस आवे से कौन जी व्यक्ति वस्तु देखिपार कौन जिन लेटर पढ़ी पार्टी ताकू आम मॉडरेट विजुअल आक्यूटी कही था. मॉडरेट विजुअल आक्यूटी 6/18 अटे से विजुअल से सीवियर लॉस ऑफ विजुअल फील्ड होता है. ओके, Then come to the management. When you enter the blindness person's room, first introduce your name and address to the patient to in the confidence of and also maintain the proper conversation and talking them how you come here and why you come to the patient side. Introduce the patient to the any roommates. Ask the patient what they are able to see. Few patients are total blind, so that was for that reasons ask the patient what they are able to see. Ask the patient what assistant will be needed at the time of the working time of the at the time of the raising or any needed or for the eating, drinking, and going the toilet etc. So for that reasons ask the patient what are the assistance is required. And after complete your conversation between the patient with the nurse, that is the blindness person with the nurse, then say goodbye after leaving the room. When leaving the room also said that I leave the rooms, okay. In that sentence also be said to the person to the blindness persons, by which the blind persons always be feel the safe and the create a confidence in his mind. And place the phone, call bell, bedside tables near the patient side. Whatever the needed at any time they will be reaches to the articles. This is to the pick up the articles. Then come to the sensory aids. In the sensory aids, many sensory aids are available for the patient who have a visual field deficit. It is available in the home and the healthcare settings. In all situations, the assistance also required for the according to the need of the blindness peoples for to handle the situations. Then what are the sensory aids of the visual deficit? All I know that eyeglasses are required for the correct prescription, and it is wear by the partial visual field deficit persons, and that eyeglasses should be very clean and a very good repair. Room should be adequate lighting and sunglasses. Use the low vision persons also use the sunglasses that are helpful for the reduce the glare and reduce the excess sun rays. Which he or she uses magnetic glasses and phone dialer with large numbers. Also he sensory aids like the phone dialer will be kept near the patient side which have the large numbers so that the blindness persons will easily identify the numbers because it is very large. So letter it is said letter is there in such a way that the blindness persons by the hand or finger they will easily identify it, and it will be for that reasons the training will be provided to the persons. Also provide clock and registry watch with large numbers and reading the material with large print. The near sightedness person or the far sightedness persons they cannot be read properly, so that the reading so that the print whatever there that is a large print, and by which the persons the low visions or poor visual acuity persons can read properly the letters. And braille should provided a record the books, okay. So braille also provided for the finding the instructions and reading the letters properly and finding the informations also properly. Then come the promoting the use of the other senses. When nurses find that one sense is lost, then instead of the patient that other senses also be applied instead of the one senses. ଯଦି ଗୋଟେ ସେନ୍ସ ଲସ୍ ହେଉଛି ତ ଅଦର ସେନ୍ସ ଗୁଡ଼ାକ ୟୁଜ୍ କରିକି ତାର ସବୁ କାମ ହାସଲ ସବୁ କାମ କରିବା ପାଇଁ ନର୍ସ କ'ଣ କରେ ନା ନର୍ସ लो पुअर विजुअल आक्टिव इंडिविजुअल को इंस्ट्रक्शन दे थाए जदि गोटे सेन्स लॉस होची तो अदर सेन्स अप्लाई करिकी कौन करवा ना विभिन्न प्रकार वर्क करि परिबा सो टीच द क्लाइंट टू यूज द अदर सेन्सेस टू सप्लीमेंट द लॉस जति सेन्स लॉस होईची ताको सप्लीमेंट करिया पई अदर सेन्स गुडा को यूज करबा उचित example for the visual impaired client stimulation for hearing taste smell touch can be encouraged यदि कौन से व्यक्ति visual impaired रही ताको hearing taste smell एवं टच सेंसेशन दे टच सेंसेशन से जेपरी से स्टिमुलेशन प्रति जेपरी तार एनकरेज रहिबो एवं से स्टिमुलेशन ठीक रे जानि परिबो सेति पई ध्यान देबा उचित सो the persons who have the visual impaired that individual will be stimulated to the hearing taste smell and touch sensation okay provide the fresh flowers scented candles or room fragrance or brewing coffee and baking that stimulate the sense of smell यदि सेंस ऑफ स्मेल को स्टिमुलेट करिया पई बा व्यक्ति सेंस स्मेल जानि पारु नै तो व्यक्तिर विजुअल तो इम्पैक्ट रही किंतु तार सेंस ऑफ स्मेल टेस्ट हियरिंग टच स्टिमुलेशन विभिन्न प्रोसेस अप्लाई करिया पड़ी थाए कारण व्यक्तिर से गुड़ाक सब एक्टिवेशन न था सो फॉर दैट रीजन्स टू एक्टिवेट द सेंस ऑफ स्मेल वी गिव द रूम फ्रेगनेंस ब्रीविंग कॉफी बेकिंग एसेट्रा and give the perfume of sweet peach provide the perfume of sweet peach and familiar odors to stimulate the pleasant taste also as well as the smell also and giving the huge massage brushing grooming and different textures clothing for the stimulate the touch तो व्यक्ति को आम मेसेज करवा तार हेयर को हेयर ब्रशिंग करवा ताको भल भाव क्लथ्स पिंधेबा या द्वारा कौन हुए ना तार टच रेस्पिरेटरटा स्टिमुलेशन हो जाए बारंबार आगे कले टच रेस्पिरेटर बारंबार बॉडी व्यक्ति को व्यक्तिर बॉडी को बारंबार टच कले तेणु तार सेंस रिसेप्टर गुड़ा बारंबार स्टिमुलेट होता एवं इंडिविजुअल टच रिसेप्टर बहुत एक्टिवेशन हो जाए और तार निजक निज तार टच रिसेप्टर जब एक्टिवेशन है ताहले को तार व्यक्तिर बॉडी से निज निज केयर नहीं पारे और निजे निजे बेले बेले हेयर कम्बिंग करें निजे ड्रेस पिंधि पारे तो पुअर विजुअल एक्टिव व्यक्ति जदि गोटे सेंस लॉस हो तो अदर सेंस गुड़ा एक्टिवेशन कले कौन तार तार अन्य वर्क गुड़ाक से सहज कर then communicating effectively the persons individual who have the sensory deficit so that persons require the communications by which they convey their message and maintain the self-esteem self-esteem and give respect and also take respect from the others the visual impairment persons that cannot identify the non-verbal cues so that the communications during the conversations so communications at the time the spoken words say the spoken words and a good tone of voice that also enhance the communication pattern between the nurse and the patient विजुअल इम्पेयर्ड व्यक्ति मैंने जेहेतु देखिपार से किसी फेशियल एक्सप्रेशन द्वारा हो कि ठार मध्यम से किसी बुझीपार न तेणु भल भाव में कहवा और भल स्पोकन वर्ड देकी जदि सहित कथा हाँ ताले से भल भाव में कम्युनिकेशन मेथड भल भाव में प्रोग्रेस होता है और जहाँ दरकार से आम जोगे पाई था तार केयर नहीं पारि था सो विजुअल डेफिशिएंट पर्सन्स so in which way we communicate with the visual deficit individual during the entry of the client's room first identify yourself by your name and if the patient has the partial vision loss stay the client's field of vision during the vision always you stay the side of the patient, because patient has the partial vision loss. And always nurse will be always speak a warm or pleasant voice to the patient for enhance the rapid communications and easy understand the procedures. And also be whatever the assistance required without fear, uh, patient say to the nurse, and care should be given and better. Okay, always explain that what type procedures provided. So before touching the person always said that what type procedure will be do at that time, to in the confidence, and also finding the by the assistance, by the cooperations or reassurance we progress the procedure. Whatever sounds from the environment, that also explain that that is the music sound comes from the environment, that is choral sound is every sound, so whatever comes that will also explain. And activated the senses, other senses levels to for the to providing the better care to the patient, also patient find the better care. Next, the patient in the bed. On the a visual acute individual stay in the bed, in the bedside, put patient's identifier sign above the patient bed and door station. The bedside रे बा door station रे गोटे patient identifier sign रखिबा काहेकि ना and also in the bed put a adjustable light for the patient. Okay, and make their pill bottle with large print labels for टाइटल मार्क such as ब्रेली और पॉलीमार्क. ताले आमे कौन करिबा बेड पाखरे गोटे पेशेंट आइडेंटिफायर साइन रखिबा जो थरे कि डोर स्टेशन रे रखिबा एबे पेशेंट भी रखिबा जेतले कि पेशेंट जानि परिबो जे सेटा तार बेड बोली से जानि परिबो. एवं किछि एडजस्टिंग लाइट रखिबा काहेकि ना बेले बेले भल से देखा कोन से जिंस काम कला समय देखा जायनी बा प्रोसीजर बा खाइला समय हो कि उठला समय बा बस बा सोइला समय किछि जिंस तार दरकार होछि क्लथेस्टा किछि जिनस को रिसीव करुच्ची कि कौन सी जिन लिखार व्यस्त रोचे कि खाइबार हो जहाँ भी हो तो लाइट दरकार से लाइट आम जोगे लाइट ऑल्सो प्रोवाइड द लाइटिंग व्हेन यूज द पिल बॉटल. That should be labeling for the making the title response. Okay, and do not move the patient, do not instruct the patient to move alone after training, and they also instruct the patient to move in the necessary in the safety area. If any items are there on the front of the patient, that will be removed. And also identify the patient about the new locations area in the hospital as well as in the home. And before taking any type procedure, always inform to the patient what the procedure you carry on. If bandaging in the eye, make sure the patient ears and other sensory organs are not obscured. ଯଦି ଆଇର ବ୍ୟାଣ୍ଡେଜ୍ ହେଉଛି ତ ସେ ତା ଦ୍ୱାରା ତାର ପେସେଣ୍ଟର ଇୟର ଉପରେ ଇୟର ଉପରେ ହେଉ କିମ୍ବା ଅନ୍ୟ କୌଣସି ଅର୍ଗାନ ଉପରେ ଯେମିତି ଅଫେଣ୍ଡ ନ ପକାଏ ସେଥିପାଇଁ ନର୍ସ ଧ୍ୟାନ ଦେବା ଉଚିତ. Patient identifier sign, then will be discuss regarding the patient identifier sign. A patient identifier sign is a sign specially designed for use in the hospital to improve the quality of care for patient. तो patient quality of care को improve करने ପାଇଁ a special patient identifier sign रही. Okay, the sign state that कहीं से sign ର अर्थ କ'ଣ से sign ସବୁବେଳେ କହୁଛି ଯେ I am vision impaired persons, please introduce yourself and let me know when you leave. Okay, प्लीज आस्क इफ आई नीड असिस्टांट. ताले से जो साइन रोचे पेसेंट आइडेंटिफायर साइन ता से साइन रो अर्थ होला जे कहू से साइन कहू जे मु होची गोटे विजन इम्पेयर्ड पर्सन, दया करके गिव योर इंट्रोडक्शंस एंड व्हेन यू लीव फ्रॉम द रूम let to me know that when you leave, ଯେତେବେଳେ ତୁମେ ଯାଉଛ ତୁମେ ଯଦି ଗଲା ସମୟରେ ତୁମେ ଯାଉଛ ବୋଲି କହିବ। ଯଦି କିଛି ଆସିଷ୍ଟାଣ୍ଟ ଦରକାର ହେଉଛି ତାହେଲେ ଭିଜୁଆଲ୍ ଇମ୍ପେୟାର୍ଡ ପର୍ସନ୍ ମଧ୍ୟ ମଗାଇ ପାରିବେ। ଓକେ, ତ ଏହା ହେଉଛି patient identifier sign. The signs are displayed above the patient bed that provides magnifiers, and also hospital staff also identify which type of patient has very low visions so that they require the quality of care. ତାହେଲେ ଏଇ ଯେଉଁ ସାଇନ୍ସ ରହୁଛି ଏକ ପେସେଣ୍ଟର ବେଡ୍ ଉପରେ ରଖିବା ଏବଂ ହସ୍ପିଟାଲ ଷ୍ଟାଫକୁ ମଧ୍ୟ ହସ୍ପିଟାଲ ଷ୍ଟାଫକୁ ମଧ୍ୟ ପେସେଣ୍ଟକୁ ଖୋଜିଥାନ୍ତି କେଉଁ ପେସେଣ୍ଟ ଲୋ ଭିଜନରେ ଅଛନ୍ତି ସେ ଭଲ ଭାବରେ ଜାଣିପାରନ୍ତି। ଓକେ, ତ ଯାହା ସବୁ ଭିଜୁଆଲ୍ ଆକ୍ୟୁଟି ଟେଷ୍ଟ ଯାହା ସବୁ ରିପୋର୍ଟ ଅଛି ବା ପେସେଣ୍ଟର ଯାହା ସବୁ ଆଟ୍ରିବ୍ୟୁସନ୍ ରହିଛି ସେଥିରେ ଗୋଟେ କପି କ୍ଲାଏଣ୍ଟ ରଖିବ, ଆଉ ଗୋଟେ ଫ୍ୟାମିଲି ମେମ୍ବର ତାଙ୍କ ବା ଇନଷ୍ଟିଟ୍ୟୁସନ୍ ରଖିବ ଗୋଟେ କପି, ଆଉ ଗୋଟେ କପି ଫ୍ୟାମିଲି ମେମ୍ବର ଘରକୁ ନେଇଯାଇଥାନ୍ତି। ଓକେ, ଦେନ୍ କମ୍ ଟୁ ଦ ମୋବାଇଲ୍ ପେସେଣ୍ଟ। Always when the patients are admitted in the hospital, the blind association institutions ଯେତେବେଳେ ସେ ରହିଲା କିମ୍ବା ହସ୍ପିଟାଲ ରହିଲା ତ ଫାଷ୍ଟ will orient the patient about their area which is the central area and which is their bed. Okay, and if the patient is unknown about the new area, then identify the area by the using the soft tone voice through by the verbal direction. Okay, if the ask the patient if the patient required the nurse's hand for the identify the new area, and that also be find it. ଯଦି ସେ ଚାହୁଁଥିବ ଯେ ଅନ୍ୟ ଜଣେ ବ୍ୟକ୍ତି ହେଉ କିମ୍ବା ନର୍ସର ହାତ ଧରିକି କୌଣସି ଜିନିଷକୁ ଜାଣିବା ପାଇଁ ନର୍ସର ହାତ ଧରିଲା ପରେ ବା କିଛି ଗାଇଡ଼ିଂ ପର୍ପଜରେ ମଧ୍ୟ ହେଉ, ଯଦି କିଛି ଗାଇଡ଼ିଂ ପର୍ପଜରେ ଯେତେବେଳେ ଇଣ୍ଡିଭିଜୁଆଲ୍ କ'ଣ କରେ କୌଣସି ଜିନିଷକୁ ଜାଣିବାକୁ ଚାହେଁ, ସେ ମଧ୍ୟ ଯଦି ଚାହୁଁଛି ଯେ ଅନ୍ୟର ହାତ ଧରିବା ଦ୍ୱାରା ସେ କୌଣସି ଜାଗାକୁ ଚିହ୍ନଟକରଣ କରିପାରିବ ବା କିଛି ଜିନିଷ ଜାଣିପାରିବ, ତାହେଲେ ତାକୁ ଆଲାଉ କରିବା ଉଚିତ। ଓକେ, so ask the patient if they would like to take your arm for a guiding purpose. If so, let them hold your arm above the elbow with their thumb to the front. ଓକେ, ଯଦି ତୁମେ ପଚାରିବ ଯଦି କିଛି ତୁମର ମୋର ହାତ ଦରକାର କି ତୁମର କିଛି କୌଣସି ସାହାଯ୍ୟ କରିବା ପାଇଁ, ତାହେଲେ ତୁମେ ହାତ ନିଜେ ବଢ଼ାଇ ଦେବା ଉଚିତ। ଦେନ୍ କମ୍ ଟୁ ଦ ଚିଲଡ୍ରେନ୍। If the child has poor visual acuity, then a medical staff of the hospital asks to the family member or their parent what of the special needs required to the child should be provided, and if it is needed, then one member of the family should be remain there. The children ଯେତେବେଳେ ରହୁଥାନ୍ତି କୌଣସି ଇନଷ୍ଟିଟ୍ୟୁସନ୍ ବ୍ଲାଇଣ୍ଡ ଇନଷ୍ଟିଟ୍ୟୁସନ୍ରେ ବା ହସ୍ପିଟାଲରେ, ତାର ପ୍ୟାରେଣ୍ଟସ୍ ସହିତ ଡିସ୍କସନ୍ କରାଯାଏ ଯେ ଯାହା ତାର ଦରକାର ତାକୁ ଯୋଗାଇ ଦିଅନ୍ତୁ ଏବଂ ଫ୍ୟାମିଲି ଗୋଟେ କୌଣସି ସଦସ୍ୟ ତାଙ୍କ ପାଖରେ ରୁହନ୍ତୁ। ସେ ଷ୍ଟ୍ରେନ୍ଥନେସ୍ ହେଲା ପର୍ଯ୍ୟନ୍ତ ବା ସେ କିଛି ସେ ବଡ଼ ହେଲା ପର୍ଯ୍ୟନ୍ତ ତ ହସ୍ପିଟାଲ ହବ ଇନଷ୍ଟିଟ୍ୟୁସନ୍ରେ ରହିବା ଉଚିତ। ଏହା ଯଦି ଇନଷ୍ଟ୍ରକ୍ସନ୍ ଦିଆଯାଇଥାଏ ତାହେଲେ କୌଣସି ମେମ୍ବର ମଧ୍ୟ ଫ୍ୟାମିଲିର କୌଣସି ସଦସ୍ୟ ମଧ୍ୟ ଚିଲଡ୍ରେନ୍ ପାଖରେ ରହିପାରିବେ। So that parents should stay with the child and make a lengthy visit while the environment is still unfamiliar. Next come the babies. A baby who is blind learn about their surrounding through the mouthing, later through their tactile expression. ତାହେଲେ ବେବି ଯଦି ବ୍ଲାଇଣ୍ଡ ରହୁଛି, ବ୍ଲାଇଣ୍ଡ ଥିଲେ ମଧ୍ୟ ବି ସେ ମାଉଥ୍ ଦ୍ୱାରା ତା ସରାଉଣ୍ଡିଂ से तार सराउंडिंग विषय जापर और माउथ द्वारा से जिनस कौन सब जिनस माउथ द्वारा सब जिन खाईपर और पी भी पार। ओके सो ए टाटाल एक्सप्रेशन टाटाली स्टिमुलेशन बहुत होता है। ताले बेबी केस जी आम चिंता करवा। ओके तो गोटे गोटे बेबी कहते ब्लाइंडनेस अटंती से विभिन्न प्रकार फिजिकल हैंडिकैप्ट होता। ओके से डिफनेस होता कि डम्ब होता। तो भेरी टाइप द बेबीज आइदर बिकम्स अ ब्लाइंडनेस दे बिकम्स अ डिम डम्ब or severe deafness. So that type of babies cannot live alone from the hospital institutions and stay in the near the sites and provide the various type of stimulation such as says to the babies like the soft talking about that what are you doing, that type soft talking also be tell to the babies and tossed gently to the baby's skins so that skin sensation occurs and the skin stimulations or tactile stimulation occurs through the baby becomes the laughing, crying, etc. And toys should provide to the babies for the playing purpose and feeling the happy and giving the enjoyment to the babies. And and pleasant music should be provided to the babies so that babies through by the hearing they will be feel happy and safe. Then toddler and preschooler child. In the toddler preschooler child, always explain so what are you doing and describe new surrounding and situation. ଯେତେବେଳେ toddler ବା preschooler child ଅଛନ୍ତି ତାଙ୍କୁ new surrounding situation ବିଷୟରେ କହିବା ଏବଂ କ'ଣ କରୁଛ ତା ଉପରେ detail describe କରିବା. And when you give a object so you use a hands on approach to introduce new object. ଯେତେବେଳେ ଗୋଟେ ନୂଆ ଜିନିଷ ଦେଖୁଛ ତାହେଲେ ତାକୁ ହାତ ବଢ଼ାଇ ତାକୁ ଦେବ ଯେ ଏଇଟା ହେଉଛି ଏଇ ଅବଜେକ୍ଟ। ମନେକର ଟୋଡଲର ପିରିୟଡ଼ରେ ଆମେ ଟୋଡଲର ପିରିୟଡ଼ରେ ଇଣ୍ଡିଭିଜୁଆଲ୍ କ'ଣ କରେ ନା କୌଣସି କ୍ଲଥ୍ ବିଷୟରେ ତା'ର ଧାରଣା ନଥାଏ କିମ୍ବା କୌଣସି ବସ୍ତୁ ଉପରେ ଧାରଣା ନଥାଏ। ଏଇଟା ହେଉଛି ଦ୍ୟାଟ୍ ଇଜ୍ ଦ ପିନ୍, ଦ୍ୟାଟ୍ ଇଜ୍ ଦ ୟୁଟେନ୍ସିଲ୍। ତ ଭେରି ଟାଇପ୍ ୟୁଟେନ୍ସିଲ୍ ବିଷୟରେ ଜାଣିବା ପାଇଁ ତାକୁ ମଧ୍ୟ କହିଥାଉ କିମ୍ବା ତାର ବିଭିନ୍ନ ପ୍ରକାର ଭେରି ଟାଇପ୍ର କ୍ଲଥ୍ସ ଉପରେ ମଧ୍ୟ ତା ହାତରେ ଦେଇ କହିଥାଉ। ସୋ ୟୁଜ୍ ଅଫ୍ ହ୍ୟାଣ୍ଡ ଆପ୍ରୋଚ୍ ଫର୍ introduce the new situations or new object. And here the toddler and preschoolers avoid talking about their condition in their presence. ଯଦି କୌଣସି ତାଙ୍କର ଯଦି କିଛି ପ୍ରୋବ୍ଲେମ୍ ହେଇଥିବ ତାହେଲେ ସେମାନେ କ'ଣ କରନ୍ତି ସାଧାରଣତଃ ସେଇଟା ପ୍ରକାଶ କରନ୍ତି ନାହିଁ। So avoid talking about their condition in their presence. And ଯଦି କିଛି ଅବଷ୍ଟାକଲ୍ ବା ହାଜାର୍ଡ଼ ରହିଛି ସେ ଭିତରେ ସତର୍କ ରହିବା ଉଚିତ, କାରଣ ହାଜାର୍ଡ଼ ରହିଲେ ତ ଟୋଡଲର ପ୍ରିସ୍କୁଲର ଚାଇଲ୍ଡ କ'ଣ କରନ୍ତି ସେ ହାଜାର୍ଡ଼କୁ ଉପରେ ଟଚ୍ କରନ୍ତି ଏବଂ ତାଙ୍କ ଉପରେ ବହୁତ କ୍ଷତି ପହଞ୍ଚାଇଥାଏ। ଓକେ ଯଦି କିଛି ଫର୍ଣ୍ଣିଚର୍ ରହୁଛି ରୁମ୍ରେ ହେଉ କିମ୍ବା ହସ୍ପିଟାଲ୍ ହେଉ ତାହେଲେ ତାକୁ ଅନନେସେସରି ଯଦି ଫର୍ଣ୍ଣିଚର୍ ରହୁଛି ତାକୁ ଟଚ୍ କରିବା ପାଇଁ ଟୋଡଲର ବା ପ୍ରିସ୍କୁଲ ଚାଇଲ୍ଡଙ୍କୁ ଇନଷ୍ଟ୍ରକ୍ସନ୍ ଦେବା। ଓକେ the meal time in the loud voice read the menu of the items to the poor visual acute individuals. And also be instructed to the also given instruction to the poor acute individual that in which type of meal comes in which times and what are the items now cooked. And also menu is there and read the menu loud voice in day to day what of the menu comes and take the food. Okay example in the morning section the 7 o'clock there is a breakfast is prepared. In the 1 o'clock or 12 o'clock the lunch is prepared. And in the evening time the evening time the also be definitely be ready. And the next in the 10 to 9 hours of the night the dinner will be taken. So in this way a menu is prepared, and in which time the food will come, it will be given, that this type of instructions given to the poor acuity individuals, then it will be helpful for the poor acuity individual to take the foods in the proper way and utilize and maintain their care. Then come to the hearing impairment. Hearing impairment. Hearing impairment individual cannot detect any object properly because due to the loss they are hearing. Okay. तो हियरिंग इम्पेयर्ड इंडिविजुअल कौन सी ऑब्जेक्ट को ठीक भाव में ठीक भाव में परसीव କରିପାରନ୍ତିନି କିମ୍ବା ତାକୁ ଠିକ୍ ଭାବରେ ଚିହ୍ନଟକରଣ କରିପାରନ୍ତିନି, କାହିଁକିନା ତାଙ୍କର ଭିଜୁଆଲ୍ ଲସ୍ ହୋଇସାରିଛି। ଓକେ, ଏବଂ ସେମାନେ ଡିଫନେସ୍ କଣ୍ଡିସନରେ ରହିଛନ୍ତି। ସୋ ହିୟରିଂ ଇମ୍ପେୟାରମେଣ୍ଟ ଇଜ୍ ଏ କଣ୍ଡିସନ୍ସ that causes the hardness of the hearing, where the individual cannot detect the object properly, okay, and cannot perceive the object, cannot perceive the sounds properly. तो हियरिंग इम्पेयर्ड इंडिविजुअल कौन करती, जेहेतु से डिफनेस कंडीशन रही, हियरिंग बहुत हार्ड होता है एवं से ठीक भाव में कौन सी जिनस को कौन सी साउंड को डिटेक्ट करें कि परसीव करें। ओके, सो हियरिंग इम्पेयर्ड again said that hearing impairment individual cannot detect the sound properly and cannot identify the which type of sound, cannot identify the sound properly, and unable to detect and perceive the sound a good manner. Okay, so here a mild hearing loss, that is cannot be considered as the disability, because in the mild hearing loss the person also hear the sounds in the sometimes, so it cannot be considered as a disability. So common cause of the conductive hearing loss, and so common cause of the conductive hearing loss in the ear that are include the infection of the middle ear, by which fluid will be accumulated, then pus will be formed, then the damage to the ear canal, eardrum, and if the earwax blocking the ear canal, that causes the infection and pus will be formed. So in this way, and the eardrum as well as the canal will be impacted and will be damaged. If the any bones of the middle ear, that will be in surgery case, that will be surgeon that the any bones of the middle ear becomes undergoing the any type of surgical procedure, surgical operation. So after that also be ear drum will be damaged due to the surgery, and that causes the hearing impairment. Different type of etiology causes of the hearing loss is there. First is the damage to the inner ear during the aging, due to the progression of the age from the childhood to the younger stage, then the old age. And if the person's exposed to the loud noise, if the if due to the some cause, due to the some object, if that is a tear will be formed in the hairs or nerve of the cell of the cochlea of the inner ear, then the inner ear will be damaged, the hearing loss, the person undergo the hearing loss. So summarizedly I will say that if the hairs or nerve cells are damaged, and if the any wear or tear on the hair or nerve cells in the cochlea, if the person is exposed to the loud noise, and if the patient receive the high pitched tones, okay, so by which the nerve cells are damaged of the inner ear, and person goes to the hearing loss or hearing impairment. If the earwax will form earwax will be formed again and again in the ear canal, then ear wax can block the ear canal, and the main function of the ear canal is the helpful for the transfer of the sound wave. So due to the ear blockage of ear wax in the ear canal, the sound will cannot move to proper way. The ear wax जेहेतु कान ear wax जेहेतु ear canal रहिला ब्लॉक ear canal रे ब्लॉक करिकी इयर वैक्स गुड़ाक आकुमुलेसन होइकी इयर कैनाल रहिबा फल इयर कैनाल ब्लॉक हो गला एवं साउंड वेव ठीक भाव में कंडक्शन हो पाइला नहीं ट्रांसफर हो पाइला नहीं जहाँफल कि भल भाव में शब्द को आम चिन्हटकरण कर नहीं. सो ड्यू टू ब्लॉकेज ऑफ इयर वैक्स दैट कॉजेस द हियरिंग लॉस. Then ear infection or abnormal bone growth or tumor. If any infection of the ear canal or the tumor will grows in the middle ear, that causes the hearing loss. If the eardrum will be ruptured due to the some types of foreign due to some type due to entry of the foreign particles, and due to the alternate the pressure changes in the ear, due to the any type of object will be entered to the ear canal and to causes injury to the eardrum, and as the eardrum ruptured, then the person goes to the hearing loss. Some sensory aids of hearing deficit as there: sign language, lip reading, hearing aid in good order, amplified telephones, telecommunication device for the deaf persons, flashing alarm clock, flashing smoke detector. These are the common sensory aids of the hearing deficit persons. जो मैंने भले शुणती ना गुड़े सेंसरी एड्स रही जोटा कि कान लगे द्वारा से भल भाव शुणी पारि तथा हियरिंग एड दबा लिप रीडिंग, साइन लैंग्वेज, एम्प्लीफाइड टेलीफोन्स, telecommunication device, flashing alarm clock. These are the common sensory aids for the hearing deficit individual.